Hey everyone, and welcome to the Concierge Doctors of Scottsdale podcast. I'm here with Dr. Felton. If you want to introduce yourself.
Hi everyone, I'm Dr. Lynnea Felton. I am a naturopathic physician primarily specializing in women's medicine.
Great. And I am Dr. Mike Gonzalez, and I specialize in lifestyle medicine. So I'm the doc you go to learn all about diet, exercise, sleep, and things like that. So I hope you enjoy the content that we're about to create. And if you have any questions, comment below. And if you can, subscribe to the channel. Alrighty. So what's going on?
Nothing much. Had a busy week.
Yeah, what'd you see?
I've been seeing a lot of women lately doing women's exams because, people come in annually for those.
Mm-hmm.
And doing quite a bit of breast exams, just educating people on how to do them and the best time of the month to do them. And I've noticed a pretty direct correlation recently, interestingly enough, with the use of underwire bras and development of fibrocystic breast changes.
Interesting.
So basically what that means is it kind of creates like this little bit of a callus in the breast tissue, like exactly where the wire portion is rubbing up against the breast. And
bring the mic down a little bit. Right there.
Okay. Can we cut that part out?
No.
Oh.
All right, go.
And sometimes it'll create some pain during the month as our hormone cycle rather, after ovulation. So the second half of the cycle, estrogen is higher. Mm-hmm. And when estrogen is higher, there's estrogen receptors in the breast tissue. And so those will bind to the extra estrogen that's running through the bloodstream and cause the breast to enlarge. That's why a lot of women have kind of breast tenderness and breast enlargement. But when women are doing more of the underwire bras, then it's kind of a combination of all month long that wire is rubbing up against the breast tissue, causing that callus, like I mentioned before, in addition to the more estrogen that's in the body. It's just creating kind of this little storm. Mm-hmm. So sometimes women will come in and they'll usually complain of breast tenderness and breast enlargement kind of before their period starts. And doing the breast exam, I'll often find quite a bit of, it's almost like a hard little nodule that's a little bit movable. So it's just like this little ball, essentially, that's in their breast. And women can have quite a few of them depending, but I've been seeing a lot kind of along that bottom line.
Yeah. That's what I was going to ask you. What's the typical location that you find these?
So it's just exactly kind of how the wire frames the breast tissue. It's kind of from armpit to kind of mid-chest line.
Okay.
That I'll see a lot of them happen. And my job when we find anything in the breast tissue is to get people in for imaging. And so typical first step for this, depending on their age, we'll get them in for a breast ultrasound, which I do with a lot of younger women, because kind of once they reach their 50s, that's when we'll start doing mammograms. But if a patient doesn't have any family or personal history of breast cancer, then I'll send them in for an ultrasound. Basically, what an ultrasound does is decipher whether or not it's a fluid-filled mass or a solid mass. And a fluid-filled mass is also known as a cyst. And that kind of coincides with more of that callus-like fibrocystic breast changes. This is what we often see. And so women who come in with these kinds of things, there's a number of things that we do. I have been recommending several of my patients to try non-wired bras, which can be a little bit of a challenge with larger-breasted women. I've had some larger-breasted women that come in to see me that, they struggle to find a good bra that fits, but kind of through some trial and error, they've been able to find some things. Some women have gone just totally bra-free, which is really excellent. I think that with the use of bras in, recent century, I would say, it's really allowed for the chest wall muscles to really weaken and the breasts start to droop in that way. So when people go bra-free, it's allowing those chest muscles to strengthen again because the chest has to carry the breast tissue, which can be pretty heavy. Yeah. So, and that just kind of strengthens their entire being.
So how often would you say, or would you tell a patient to go bra free?
Some people do it every day, which is helpful, just to kind of build that muscle, because muscle does take some time to build, especially, I mean, we kind of know this with doing exercise and that kind of thing, like doing it a couple days a month really is not going to have the outcome that you want. And so kind of training your body without actually doing anything, just not wearing a bra, it just helps those muscles kind of relearn what they forgot.
Like maybe as soon as you get home from work, or, you know, if you're just waking up or sleeping, I'm sure you recommend sleeping without a bra.
Definitely, yep.
Waking up, just being around the house without a bra, and then if you have company over, then...
Right.
I mean, if you're comfortable being without a bra with company, then fine. If not, just throw a bra. And
it's really just to the women's comfort level, too. So if they feel comfortable not having a bra on throughout the day during, you know, their normal daytime activities, then that's excellent. If they find that they needed something more supportive, or they didn't feel comfortable without wearing a bra, there's a couple things that I recommend. So there's a lot of really great cotton bras out there that provide a lot of coverage that people seem to enjoy as well. And then there's been quite a few things in the market that are kind of like an adhesive, just to kind of cover the nipple area if that is something that you're uncomfortable with, depending on the top that you're wearing or whatever you want to do. I recently saw something that they're coming out with now, and I mean, you know, the market is ever changing, so we'll always see these kinds of things come up, but it was a larger adhesive that you can actually reuse and wash. So, you know, everyone gets a little sweaty, so just throw it in the washer, and that adhesive will maintain for several weeks. So you might need to kind of buy a couple just to keep throughout the year. But it provide the same push-up action as a push-up bra would, while also allowing the chest muscles to kind of develop and carry the breast tissue. So that's an option.
One thing I wanted to ask you, I know you mentioned in the wellness exam, you do a breast exam, which is a manual exam, where you're feeling the breast to see if there's any tender spots or these cysts or different things that could be under the breast tissue. And so I know, you know, it's recommended that you do these manual self exams, and I was going to ask you, how often should a woman be doing a self exam?
So the best time to do these is really a couple days after a period stops. And the reason that is because that's the time that there's a least amount of hormonal influence on the breast tissue. And so like I was mentioning, estrogen is highest in the second portion of the cycle. And it does get higher towards the middle, towards ovulation phase as well, which ovulation tends to occur in most women around day 14, but certainly not everyone. So it's kind of just an individualized basis. But regardless, a couple days after the period stops, so stop bleeding, I'll recommend women do this, and the best way to do this is kind of in the shower, because kind of they're already washing the area, and it's just easy, kind of a couple seconds just to make sure that the tissue feels normal to you, and then just make note of any changes that you see.
Yeah, just for reference, you mentioned the cycle. If you just explain for people watching the way the normal hormone levels go through the cycle, so you know, day 1 to 14.
So day 1 is defined as the first day of bleeding, which includes spotting as well. So if any woman, you know, if it's difficult to decipher kind of when spotting starts to when the actual bleeding begins, we like to count it on the first day of spotting. So anytime you start to notice any sort of blood in the area, that's the first day of menses or your period. And then those can last a number of days. Average is about 5 to 7 for people. And at that point, with our hormones are totally in the gutter, essentially. So the reason that we have a period is because there's no hormones there. So if we think of people who are pregnant or on birth control pills, you know, the birth control that kind of gives you 4 periods a year, that kind of thing, it's because their hormones are at a higher or kind of a stationary high level, and that prevents any sort of shedding of the lining, or also known as a period. And so when estrogen and progesterone are main hormones that coincide with period decrease, that's kind of day 1, and then start to shed the lining, which will give us a period. And then the lining will kind of run out, because that's the uterus lining will kind of run out, and that's when our period stops, and then the hormones will slowly start to climb. The first one to climb is estrogen. Starts to increase towards kind of day 10 for most women, but it does kind of have this little biphasic type method to it kind of thing.
Mm-hmm.
So estrogen will start to build. We'll start to build the uterine lining. So, the thickness of the tissue that's inside the uterus, which is passed during their period. And then progesterone will increase more towards the ovulation period, so towards mid-cycle. So estrogen starts to increase before progesterone. Progesterone increases at mid-cycle. Progesterone remains high during the rest of the cycle, so kind of from ovulation to the start of your period. And then estrogen has a slight dip towards the middle of that second half of our cycle, which is called the luteal cycle. And then it'll increase just a little bit more towards the end, right before the period, and then both hormones will drop, which causes the period to happen.
Okay. Yeah, interesting. Yeah, I just wanted to cover that briefly, just so
Yeah.
people can see that trend.
Yeah. So what will happen during PMS is what people often describe as I'm really constipated, really bloated, pretty irritable, breasts are tender and enlarged, like I was mentioning before. That's the fault of estrogen being too high in relation to progesterone.
Mm-hmm.
And so what we'll do often is treat that and allow our hormones to kind of balance themselves with some pretty gentle treatment.
Yeah.
Mm-hmm.
So back to the breast.
Mm-hmm.
So you're telling these patients to do the breast exam how often again?
Once a month
Once a month.
is best, and the reason behind that is because breasts change so quickly kind of throughout the month.
Yeah.
Being at that second half of the cycle, they do get enlarged, and if women have these kind of fibrocystic breast changes, then they'll say, hey, I have a lump, but once I check it in the beginning of the cycle, it's not there anymore. It's just best to see kind of what the baseline is after the menses or the period is done. Sometimes I'll tell women, because I do enjoy empowering women just to kind of learn more about their body and how things change during the month, is I'll have them do it beginning of the month just to get a baseline, but then also kind of right before their period just to kind of see what's happening in the breast tissue. But just to get a good baseline is once a month after period is just fine.
What's something they should be looking for when doing these exams? Because, I'm sure if you want to know what you're going to feel, because you want to be able to differentiate between something that's going to be a little bit more severe and versus maybe it's an enlarged lymph node or things like that. So what's kind of the thing they should be looking for? So
a couple different things that you might notice, and fingertips are pretty sensitive, so you can pick up on these kinds of things. The first thing being is an enlarged lymph nodes. We have lymph nodes that run through our entire body. They're important for immune function, and they do get swollen and tender with any sort of virus or any sort of bug that you might be fighting, even if you aren't showing any symptoms. And so often I'll have women come in and say, I've had some really tender underarms, and it kind of runs through the outside of the breast tissue or the lateral breast tissue. And they might find that they have kind of a large, it's almost like a marble size, can get to be that big, and tender and a little bit squishy. And that's more of a lymph node type situation. So if women are noticing that kind of in that outside portion, that's usually what that is, usually. Another thing that they can feel is something called a ropey area, which almost feels like a really tight muscle. We do have our pec muscles at the top portion of the chest, which can often get tight in many women and men as well, kind of as we're doing our day-to-day. Shoulders start to hunch forward, and also not using the correct type of bra will make that really tight as well. So if women start to feel that ropey area, which feels like a tight muscle, but you can kind of relate it to a finger almost too. So kind of like it just kind of pressing on your first finger here, you'll see kind of what that would feel like. If it is tender, it's likely to be a tight muscle, but it can also be signs of changes to the breast tissue, which you should certainly bring up to your physician and make sure that you get that breast exam done by them so that they can make sure kind of what the issue is and direct you to the appropriate type of imaging to rule out anything that might be happening there. The fibrocystic changes often feel a little bit larger than a marble. They might not be painful, or they might be painful. So it really just depends kind of what's going on there. I've had many women who, while I'm doing the breast exam, they're like, oh, it's a little bit tender as I'm pressing on that portion. And we'll just get them to imaging just to make sure there's nothing to worry about. But often I'll see those kinds of things. So really you're just looking for any areas that feel different from the normal kind of squishy, soft tissue of the breast in any way at all. even if it doesn't hurt, but you just notice some tissue change.
Yeah. And I feel like it's important, even if you do feel tender spots or maybe some kind of hard area, get it checked out.
Yeah,
right?
definitely.
Just go into the doctor, schedule an appointment, and have your doctor just look at it. And then that way, because a lot of that can cause some, especially women that have family histories of breast cancer and things like that, it can cause a lot of stress.
Totally, yeah.
And the stress aspect, it'll hang over them not knowing. So I think just going to a doctor, getting that looked at, and then just taking it off your mind. Like it's just a lymph node, or it's just a, non-cancerous substance.
Right,
You know?
which we often aren't able to determine based on our fingertip approach as well. So we usually just recommend women get the appropriate type of imaging, and we'll decide on kind of what the best way to view that would be, just to make sure that we don't have to deal with anything that's, more cancerous. But if it tends towards that as well, we can make the appropriate referrals and kind of support your body in that way as well.
Yeah. Onto the imaging topic. So if you're in the office and you come upon an abnormal finding on the breast tissue during the manual exam, what would be the next step as far as imaging, and then what are the other options for imaging?
So typically with women who don't have a family or personal history of breast cancer or any other hormone-sensitive cancers like ovarian, uterine, or cervical cancer, then I would, if they're less than 50 years old, then I'll send them for either a breast ultrasound or a breast MRI or both. I've sent a number of patients to get both of them if there's kind of a diffuse or widespread findings that I'm finding just doing the manual exam with the fingertip approach. So we'll typically go there. The ultrasound, like I said, can detect whether or not it's fluid-filled or more of a soft type mass, and the softer type masses are something that requires a little bit more, whether that be a mammogram and a biopsy or both. And MRI can really discern where these masses are and kind of what they look like, more in depth than an ultrasound, but it's a little bit more invasive, if you will. And then once we get towards the women who either have family or personal history of breast cancer or they're over the age of 50, we recommend annual mammograms as well. Mammograms are still the standard of care. I know that I'm a naturopath, and so I get a lot of women coming in to me and being like, I really don't like doing this, and I'm wondering if there's another option for me. I will always recommend a mammogram as kind of the first step. There really isn't enough research to back up the thermograms that are out there now.
Explain what that is.
So the thermogram will pick up on any sort of fast-growing or hot lesion, and it'll show in different colors. And so it kind of looks like a weather map where there's kind of like an area of storm. And so if you look on a weather map, when you have kind of those crazy storms, it's darker red or something like that. So it'll show up pretty similar on a thermogram.
Yeah.
They've had a number of false negatives on there, which is something that, false negatives means that it didn't show something and there was actually something there, which is definitely not anything that we want to do for our patients. We want to make sure that we're giving them and us, of course, the peace of mind that, we're treating the cause, treating what is there and making sure that there isn't anything that we miss, because that would be bad for everyone.
Yeah, because time is important. Right.
What I will do often with mammograms, I think that I've only ordered this as a 3D mammogram, and the typical picture that we get with mammograms is a 2D, so it's just kind of the front and back of things. The 3D mammogram gives more of an arc picture, so it'll tell us, especially women who have denser breast tissue, which you really only find when you're doing a mammogram to determine kind of what type of breast tissue they have. The 3D mammogram will give a really nice 3D picture of kind of how things are. And they've done some comparative studies of the 2D mammograms to the 3D and different calcifications that they might find on the 2D that were really small, if they couldn't really tell what it was, or if a patient had really dense breast tissue. Difficult to tell kind of what's going on. They'll do a 3D and we'll be able to determine kind of, this is what the mass, if it is one, what it looks like, kind of where it's growing, and monitor it in that way. And I do understand it can be a little bit uncomfortable for people, but it is a really necessary exam that gives us a lot of information in terms of where to go from here and how often to repeat that imaging.
Yeah, great. I think that's a lot of good information on breast health. And so just as a brief overview, so one is, giving yourself monthly breast exams.
Right after period stops.
Right after the period stops. Maybe asking a doctor on how to do that. I'm sure there's YouTube videos out there that you can look up and it'll show you. But yeah, going asking your doctor, how do I do that? Doing it monthly, right after the period stops. And then removing some of the obstacles like the wired bras, getting rid of those. And then, if something comes up, just going to your doctor and getting that clarity and figuring out what it is and not putting it off, I think is important. Because like I said, the time aspect is good. You want to get good information. And at the same time, you want to get a doctor that's going to use the proper imaging. Because you mentioned thermography, but you mentioned the issues with thermography sometimes. And so I think that's a good amount of information. Was there anything else you wanted to add?
Yeah, so just some basic things that you can do for breast health is to increase your ingestion of broccoli. Broccoli has a component in it called DIM, or diindolylmethane, that we'll often prescribe or recommend to people just to keep the estrogen in check. But rather than doing a supplement, just increasing your intake of it is a great place to start. And it's broccoli, cabbage, and cauliflower have the highest content of that. And so starting there, changing all of your plastic items to glass. So any plastic water bottles, any plastic dishware, anything like that. Plastics tend towards interrupting our endocrine or our hormones and have a really heavy influence on how much estrogen that women produce, and men as well. And so changing to something that's glass is a kind of an easier fix, but something that is pretty helpful. And then eliminating any sort of processed foods too is a good place to start. Yeah. And then from there, coming to your doctor, making sure that breast tissue is in normal there. Kind of learning the best method for you to check breast tissue. There's a number of different ways that people do it, and the docs are pretty good at explaining kind of what the best would be for your breast and body type would be. Yeah.
Okay. Well, I think that was pretty much it. It's a lot of information.
Yeah.
That'll conclude the first podcast, or one of the podcasts. And if you have any questions or you'd like to contact us, you can obviously comment below. Subscribe to our channel. We're going to be posting a lot more content like this, just information to empower women, empower men, and really get your lifestyle back on track in a healthier direction. And so if you have any questions, comment below. You can visit our website at conciergedoctorsaz.com, and then follow us on Instagram at conciergedoctors. Is there anything else you'd like to say?
No. Great meeting you guys. Look forward to chatting in the future.
Awesome. All right. See you guys.
Take care.